Hey everyone, this is Jana, Target Functional Medicine Approach Nurse Practitioner. I just realized that I don't have much on the Graves' disease or hyperthyroidism and wanted to share some of my tidbits on that. I do not have many patients with Graves because Graves is much less prevalent than Hashimoto's or hypothyroidism, caused by different causes other than Hashimoto's. But the little tidbits that I have to talk about today would be sometimes Graves or hyperthyroidism, too much thyroid hormone could be triggered by taking high doses of iodine. I had a case like that when the patient came into me because her naturopathic doctor wouldn't prescribe her Armor or any type of thyroid hormone, and she was adamant about trying some. But before she tried some, she also tried very high dose iodine. I think when she came in, she was taking 20 or 50 milligrams of iodine. The issue was that somehow her body couldn't handle it, and her free T3, free T4 were super high. They were like 7 for free T3 and free T4. That I don't remember. But anyway, the basic thing that she had to do is to get off the high dose iodine. So I do have patients who have high antibodies that are indicative for Graves' disease, but they're also indicative of Hashimoto's disease. So as this would be the worst case scenario when Hashimoto's and Graves coexist. So it means there is presence of antibodies specific for Hashimoto's and antibodies specific for Graves' disease. And the reason I'm so late up, it's not too late in Arizona, is that I had a cup of tea. Of course, it was very smart of me to do at 6 p.m. And now I'm like, really? What do we do with this? But anyway, so people who come with high thyroid hormones, they may have, in my patients in particular, they do have anxiety, irritability, heart palpitations, or have high heart rate. At the same time, they have can be having fatigue and insomnia or inability to sleep, and then they stay up late, then they sleep during the day, and they sleeping late, they cannot function. And also there could be a roller coaster of hormonal changes. It's not steady that you may have just high thyroid hormone. It could be ups and downs, and that's why everything is not clear cut. These symptoms, you would expect someone with high thyroid hormone to be skinny and losing weight, but a lot of people still struggle with weight. And at the same time, with Hashimoto's, people who have low thyroid hormone may have actually anorexia type of symptoms, like they are very skinny. It's very hard for them to gain some weight. Why Graves type of symptoms or hyperthyroidism is kind of more dangerous than Hashimoto's or hypothyroidism, because the symptoms are more radical, is high in the thyroid crisis. Thyroid toxicosis can, when the level of hormones gets so high, can come very fast and unexpectedly. So in these cases, I would suggest starting the pharmaceutical medication, that you can get from CVS or any regular pharmacy. That's the reason, because with a high blood pressure, that's common in hyperthyroidism. And high blood pressure, normal is 110 or 120 over 70 to 80. Well, with hyperthyroidism, high blood pressure could be 180 over 90 or 100. This is blood pressure that can cause strokes, and we don't want that to happen. That is the reason, my personal opinion and my professional opinion, I would start someone who comes to me with these type of symptoms on the pharmaceutical methimazole, option, low dose, and see how it goes. And also to, at the same time, I would support them with natural treatments, natural supplements. Natural, when I talk about natural, you should understand that the natural substances go through a lot of processes to become, they are derived from natural substances, but they're still very concentrated, very specific, targeted, and focused supplements. So when we talk about, it's not something that you can take from 1 teaspoon of herbal tea. It's much stronger. So it has certain effects. The side effects in natural substances derived from natural substances are usually fewer side effects than from the pharmaceuticals. But if you start low and go slow, pharmaceuticals could be well tolerated too. And when it's needed right now, right, at this moment, to be done at least for 1 or 2 months to get the symptoms under control, I would highly advise to consider them. I know a lot of people are against pharmaceutical medications, but they have a place and role, and it could be just, like I said, it could be short term. Once you get stable, you may not need it anymore. So hyperthyroidism, I see not many people are interested because it's very, very less prevalent than the hypothyroidism or Hashimoto's. Other things that could be happening with this, and what other things you could do? Definitely high blood pressure medication would be helpful. The top two options would be a beta blocker such as metoprolol, propranolol, that would decrease the heart rate and also decrease the high blood pressure, and also will help you with the anxiety symptoms right now. It doesn't mean that you would have to take it for years, until you die, basically. Just like it just means that you need this support right now to get your body calmer. The other medication that could be helpful is a calcium channel blocker, which is the high blood pressure medication too. It would not decrease the heart rate substantially at all, but it will decrease the blood pressure. And it's interesting that, for example, beta blockers are used for situational anxiety, like for the social anxiety when someone needs to give a speech. So beta blockers, the high blood pressure medication that decreases also heart rate, also used for that type of some of the situational anxiety. And probably I need sometimes to take that, especially talking to large publics, to the large groups of people. But what other things we can do to help with all this? I would consider taking L-carnitine. There is a lot of research about L-carnitine helping 2 to 4 grams, and I would start with 2 grams, or maybe even with 1 gram a day, 500 milligrams twice a day, and then increase it gradually to 1 to 2 grams, and then maybe to 3 grams a day, depending on how you feel. So that helps to decrease the thyroid hormones, free T3 and free T4. At the same time, lemon balm, which is Melissa officinalis, and I know it's very popular. Maybe some in Midwest, it just grows in your backyard, and in the same in Ukraine, it grows in your backyard, and it's used widely in teas to calm your nervous system down. But at the same time, it can be used as a supplement to decrease the thyroid hormones. Lemon balm and bugleweed. Selenium could be also used to decrease the thyroid hormones and to just support the thyroid gland. What about iodine? So iodine could be used to decrease the thyroid hormone levels, but if someone has positive TPO antibodies, thyroid peroxidase antibodies that are more they are more specific usually to Hashimoto's, I would definitely be careful with iodine. Short-term, high doses of iodine may decrease the thyroid hormones, but if there is presence of autoimmunity, that is kind of like Hashimoto's autoimmunity or the antibodies that are specific to Hashimoto's, the iodine may cause more harm than good. So it's 50-50. If you wanted to experiment, I would definitely, like I said, I had a case where the person with low thyroid hormone developed hyperthyroidism, which is high thyroid hormone, after taking high doses of iodine. So it's not something and the issue with iodine, I did high doses of iodine on myself, my husband, a few of my patients. The issue is that we don't know who's gonna do well on iodine and who's not gonna do well at all. Some people do very poorly, and it takes 1 or 2 years for them to get back to normal. So I err on the side of caution. I don't start with iodine treatment, and definitely if you do decide to do that, I would possibly look at Dr. Brownstein protocol, who treats by high doses of iodine, because he adds like 15 other supplements in addition to the high dose of iodine. So let me know if you have any questions. If it was helpful, I'd love to hear from you guys. I haven't done lives in a while, and I'm getting rusty. I need some suggestions on what to talk about. Bye.